My name is Joanne Ballentine and I'm the project lead for Hospice Enabled Dementia Partnerships. Northern Ireland Hospice recognised a few years ago that patients who have a dementia are palliative, they do have palliative needs, and that we needed to widen our access to make sure that we were providing the appropriate support for patients with dementia and for their carers. People's perception whenever they have dementia will change. They will see colours differently, they will see shapes differently. So having an environment that somebody can come into that would be very comfortable for them, so that they don't feel that there is objects blocking their pathways, such as shapes in a carpet, making sure that glass is non-reflective, making sure that you're able to identify whether it's daytime or nighttime by the use of things like dementia-friendly clocks. So what we have done with this building is to make sure that it is dementia-friendly. Our signage is dementia-friendly in that we've used colour and tone to make sure the signs really read well. On the doors of each of the rooms there are dementia-friendly signs so that somebody can pictorially see a bed as well as a number and a suite. Or even into the bathrooms, using contrast to make sure somebody's able to differentiate between the floor and the toilet or the bathroom, just to make it more comfortable for them whenever they're actually here and feel that they're being supported appropriately. For the Hospice Enabled Dementia Partnerships Day Hospice, what we have tried to do is tailor the activity programmes so that we're actually supporting somebody who has a dementia to improve their cognition and to help with some of the issues that they may have. So whenever our patients arrive, they'll be welcomed by our volunteers, get a cup of tea and scone, just made to feel welcome. Our nursing staff who are dementia trained will actually go and speak to the patients and speak to the carers, and that's the one thing we've done differently with the day hospice for the dementia services, is that our carers can actually attend at the same time as our patients are attending. We've linked in with other professionals such as the Alzheimer's Society for carer support, so they will be here at the same time as our nursing staff. Where our nursing staff are seeing the patients, the Alzheimer's Society will actually touch base with the carers to offer support and advice and help. We offer a creative therapy programme, and that will be different each week. We may have art therapy, which patients will get involved in. We may have reminiscence work. We may have music therapy that's happening where again the patients can enjoy and participate. And we find that by creating memory and stimulating memory actually supports cognition for most of these patients. Patients who attend also get access to complementary therapy just to help with some of their symptoms that they're having at that time, but our carers who attend also get access to complementary therapy. Underlying everything with day hospice is the fact it's not a social space, it is for symptom management. So if patients are experiencing pain or constipation or nausea, or just really worried about their future and wanting to make some plans with regards to advanced care planning or making decisions for the future, the nursing staff here are trained to be able to support a person with dementia to do that. We also ensure that we link in with the patient's GP and with their district nurse, who are their key worker, to ensure that that continuity with care is maintained. As a hospice nurse specialist, I'm able to go to a person's home living within the North and West Belfast area and support them for symptom management and end-of-life care whenever they solely have dementia. To be able to go in and give advice and symptom management, just letting them touch base with how things are, and giving the advice to the district nurses with regards to some medication management specifically for somebody with dementia, and linking the mental health partners together with the community and the palliative partners is really what has made a difference with this project, and actually been able to support somebody appropriately who is dying at home with dementia.